Hey guys, welcome back to another episode. My name is Dr. Josh Chigoda. Today we're going to talk about core exercises, crunches, sit-ups, and lower back pain. A lot of people will ask me, and I get a lot of questions about, hey, what exercises are good for lower back pain? And the truth is, it really kind of depends. But if you are having lower back pain where it hurts to bend forward, going forward, picking up objects off the floor, then you're probably going to want to avoid some flexion based or sit ups, crunches type based exercises because, yeah, do they affect the core? Absolutely. Can you get stronger doing it? Of course you can. But if you have this low type of back pain, then you're probably risking it because you're constantly doing flexion and you're losing that protective mechanism of that curve. And so there are way better exercises, and I highly encourage you guys to go through my channel and take a look at all the exercises I show you. But I'm going to just show you what the sit-up and the crunch looks like. So just from the side, real quick, everybody knows that when they sit up, they're kind of like that. They're doing this. And look at what's happening over here to my spine. It's rounding, and I'm coming from here, and I'm hinging up. Same thing occurs when I do this, for the most part, just not as severe. And you could actually localize this by, maybe just doing a small little movement and staying contracted. So maybe that's good, but a lot of people do this. And what they're doing, just you can't see it because my back is on the floor, is they're constantly doing this to the spine and rounding it, creating more flexion and more flexion. And if it hurts to go forward and they think they're building their core, they're really just in the long term wearing away their spine and they're wearing away their core because you're not getting stronger overall. So my advice right off the bat is possibly don't ever do sit-ups or crunches, and really just try to avoid that. So let's talk about some other exercises that you can do. Plank variations are great. You could do things such as, just holding this in place. You could raise the legs. You could raise the arms. You can plank slots. You can do bird dogs, things like this. Glute building, pelvic tilts for an example. But all these things are flexion avoidance, meaning we're not going into this position to round our spine, especially if you're having that back pain that hurts to go forward. So guys, if you're thinking about building your core, you're thinking about doing anything to improve your back pain, or if you're thinking about preventing low back pain in the future, start thinking about the curve, start thinking about your mechanics, and start thinking about what you're actually trying to do. Because if you constantly put yourself in that position that hurts you, how can the spine actually heal? How can you actually get stronger if you're constantly getting injured, right? You can't. So I would honestly tell you, probably avoid sit-ups entirely, probably avoid crunches entirely, and start focusing on some other movements that are not necessarily flexion based. So that is really my advice for you guys. So this is one of the reasons why I personally tend to tell patients not to do flexion based exercises all the time, especially ones that require you to really forcefully rock up and really round your spine intensively, because that can cause more problems in the future. All right, guys? So that's it. Try that out. I really think that you'll figure out that this is really going to be beneficial for you in the long term, because you cannot heal and you cannot get back to where you want to be if you don't stop the injury from occurring in the first place. All right, guys? So give that a try. My name is Dr. Josh Jagoda. Thanks for stopping by. We'll see you guys for the next episode. Take care.